A very warm welcome to all our esteemed guest participants who are watching us on YouTube Live, Facebook Live, and Zoom platform, who have associated and joined ICanCaRe Sunday Live in a yet another episode and a very special one. Today is Valentine Day special event. And on behalf of the entire team of ICanCaRe, I welcome each and every one you on this beautiful Sunday evening to a wonderful program on I Love You, Not Your Tobacco at ICanCaRe Sunday Live.
So Valentine Day is Dil Ka Mamla. So for our next talk, we have Dr. Manish Mittal. He is MBBS, DNB Medicine and DNB Cardiology. He is cardiologist, consultant, interventional cardiologist at Rama Hospital and Medical College and Sarvodaya Hospital Research Center. So his topic is tobacco and its cardiac side effects on women. Over to you, Dr. Manish Mittal.
I would like to thank Rashi, Dr. Pawan, and Mr. Rishabh for inviting me on in a special day to talk on tobacco and cardiac side effects on the women's health. Now I have been discussed about the tobacco use in the various form it is used. Next slide, please. And various substances it has, which cause a lot of many different kinds of health problems in adult population as well as especially the younger population and the women's health. So besides causing the different kinds of cancers, we can see the effects of the tobacco are and lungs, and that leads to the various kinds of heart diseases in such people like coronary heart disease, heart attacks, heart-related chest pain, brain strokes, high blood pressure, and the subarachnoid hemorrhages. So it is a very known fact that younger the people, the more the duration of the tobacco use, the more the cigarette they smoke per day, the higher the risk of chances of having these cardiovascular effect is there in the younger populations. So the question is, are the women at increased risk of having the coronary heart disease associated with the smoking? Is it a fact or myth? And so we would like to see the data first. It has been found in various studies. Please don't move the slide, I think. Women who smoke have an increased risk of cardiovascular disease compared to the men. And it has been found if they smoke 10 cigarettes per day, then the chances of having the coronary death is 1.8 in women and 1.2 in the men. And further, it has been studied in a large prospective study that there is almost 33% increase in the relative risk of having myocardial infarction in the females who smoke cigarettes. And the chances of having the cardiovascular risk is more in women who are younger compared to the older women. Further, if the woman is having the oral contraceptive pills for not to have the baby and who also continues to smoke, then the chances of having the cardiovascular disease is further elevated up to the 20 times in such cases. Next slide, please.
I've changed the slide.
Yeah, please change the slide.
Yeah, I've changed already. It is there.
Yeah. How the smoking causes the cardiovascular diseases. Basically, there's a nicotine substance that is the reason for its addictive effect. When we chew the tobacco or smoke the tobacco, then this nicotine substance leads to the release of the adrenaline in the body that makes the heart beat faster and further increases the flow of the blood. This way, it makes the heart and pressurizes it to more work faster and harder. Further, there is a carbon dioxide substance in the smoke, which decreases the ability of the blood to carry the oxygen in the organs and leads to its harmful effect on the cardiovascular system and other body organs. And the most important one is that the effect of the tobacco leads to the increase in the cholesterol level, and the ratio of the bad and the good cholesterol is disturbed in such cases. And what is the final effect on the blood vessels? When the cholesterol increases, that leads to the buildup of the arterial plaques on the blood vessels that further narrows the vessels, and there's a thinning of the vessels. over a period of time that is termed as a atherosclerosis, which is the main reason behind the cardiovascular effect of the tobacco on the human subjects. And this reduction in the vessel size leads to the decreased circulation of the blood in the various body organs like the heart, brain, and it may lead to the angina, heart attacks, and the brain strokes. In this slide, we can say early life, there is formation of the fatty streaks in the blood vessels, and that further leads to the fibrofatty plaque formation. And when this fibrofatty plaque formation get complicated with the formation of the thrombus, then we experience the ischemic attack in the form of heart attack or the brain stroke. Next slide, please. So the major side effects of the tobacco on the human body is the coronary artery heart disease. And it is the major cause of the death in the younger population compared with the older population. The more the younger population, they continue to smoke, they are more at risk of the coronary heart disease without any other associated risk factors like the hypertension, diabetes, or family history. And there's the increased chances of having the sticky platelets that leads to the blood clotting, and that further blocks the vascular spaces and leading to the obstruction of the vessels, and that increases the risk of heart attacks or the brain strokes, decreasing the supply of the oxygen when the blood supply is completely turned off or cut off due to the formation of such blood clots. Next slide, please. Again, we see here the coronary arteries. There's in the upper picture, there's a normal coronary artery. In the second picture, there's a artery with having the fibrofatty plaques. And in the lowermost picture, we can see there's a coronary artery having the complicated fibrofatty plaque with the blood clot that leads to the complete obstruction of the vessel, turning into the heart attacks or the angina symptoms in the patients. Next slide, please. What are the other cardiopulmonary effects of the smoking in the women? As we know, there is a carbon dioxide which reduces the carrying capacity of the oxygen in the blood that leads to the pulmonary hypertension in such young females, and that further compromises the daily working capacity and the exercise capacity of the women, and thus leads to the increased chances of the heart failure, mostly the right-sided heart failure in such young women. Besides having its cardiac effects and effects on the lungs, this smoking can also affect our blood vessels in the other parts of the body as well, like in the extremities. These are the non-coronary arteries, and patient may experience the claudication symptoms in their hands or in the feet when these fatty deposits are present in their vessels in the extremities, and there is narrowing and thinning of these vessels. Further, if their severity is very high and there is complete obstruction of these vessels, there may be the gangrene formation of their toes or fingers in the extreme form, and that may lead to the amputation in such cases. It may also affect the peripheral venous system. Patient may have thinning of the blood vessels, and they may develop the varicosities of the veins, or patient may have developed the deep venous thrombosis. Chances of increased deep venous thrombosis are there. So in nutshell, we can say the younger the woman population or the other youth, either they are the men or the women, the younger they start the use of the tobacco, there are chances of having more cardiac side effects. in this population compared with the older population. So we should sensitize them, as already emphasized by the Dr. Pawan sir and others. The younger the population, we should sensitize them more carefully to stop the use of the tobacco, because they are at more increased risk of having and the acute effects of the this tobacco use, and cardiovascular effects in the form of heart attacks or the brain strokes or the peripheral arterial diseases. So it's better to find out such high risk individuals and intervene early in those cases, so that they can be prevented from having these kinds of bad side effects, cardiovascular side effects on the with their partners, and their lives can be saved.
Thank you, Dr. Manish. You have nicely explained bad effects of tobacco on our cardiac system.
Every day, because of tobacco, 3,700 people die. 3,700, that is equivalent to 10 bombers, 10 jet being bombed or crashed every day. अगर हमारे ये देखें तो this is a very painful death, and it's not a simple, and definitely it needs an intervention. It needs everyone to join hands together. हम लोग जब साथ में जुड़ेंगे, and the सबसे बड़ा प्रॉब्लम ये है कि it is a socially acceptable custom. अभी आदित्य जी ने बताया कि we should go to the झोपड़ीज and the rural areas and then talk to the workers there. But दुख की बात यह है कि if you look into your own club, sir, maybe there you'll be finding that there will be a lot of people who are working, who are taking tobacco. And then in addition to that, if you look into it, if you extend your presence a little more, and if you go to the house of each one of your members, there would be maids, there would be the drivers, there would be the mali who might be taking tobacco, and they need to be guided. And then if you go to your each line member is an industry in himself. They have got a huge industry. They employ a lot of people. And if you look at the employment, there will be a lot of people who are taking tobacco. अगर हम अपने आप को सबसे पहले बहुत दूर ना जाते हुए, बहुत ज्यादा दूर ना जाते हुए, केवल हम अपने आसपास और अपने को एक ये जो सोशली एक्सेप्टेबल कस्टम है, इसको हम लोग एक सोशल आउटरीच की तरह हम लोग कर लेंगे, हम उसको एक्सेप्ट ही ना करें. So if you do not accept this thing as, then it itself will become it will change the society in itself, and ये झुग्गी झोपड़ी वाले जितने हैं, they themselves will start getting out of tobacco. So this is where we launched this program, the Save the Youth campaign. और Save the Youth campaign क्या है? What is युवा बचाओ अभियान? वो क्या है? Number 1, sensitize, संवेदनशील बनाना. Number 2 is assist, that is मदद करना. Number 3 is volunteer training program, that is where we train a lot of people to become to be part of the network for tobacco cessation, that is प्रशिक्षण करना. And enforce tobacco, SAVE, sensitization, assistance, volunteer training and enforcement. Sensitize, किस चीज का sensitize करें? This is very important. So आदित्य जी को मैं बताऊंगा. Number 3 things we want to sensitize. Number 1 is be smart, do not start. जागरूक रहें, प्रारंभ ना करें. Number 2 is be careful and fearful. Be careful and fearful. Please mark my word. Be careful and fearful of tobacco. People using tobacco around you. And win over tobacco made easy. That is कि तंबाकू को हम लोग आसानी से छोड़ सकते हैं. So this is the sensitization program. And then assist, that is assist to quit tobacco. So we have got everything with us, ready with us. To ICanCaRe has developed each and every protocol to help people quit tobacco. We have got the quit line, we have got the app, which Rishabh will be talking about, the self-help books, the online cessation methods, cessation centers, online group counseling methods, online consultation, e-commerce portal, so that the medicines can be sent to the person who is requiring it, and ICanCaRe app. Then the network, the network is very important to develop the volunteers, the marshals, the ambassadors, alliance partners, and specialists. And this is where we are working. And of course, the enforcing tobacco-free zones. So be careful and fearful. This is something what I specifically say. हमें एक outreach करना है. We have to create that feeling among the society that we will refuse, we will not accept anyone taking tobacco. Refuse to take tobacco. हम खुद नहीं लेंगे तंबाकू. We will not refuse to take tobacco. Refuse to be a friend of a tobacco user. जो तंबाकू लेता है उसका साथ में हम दोस्त भी नहीं रहेंगे. Refuse to marry a tobacco user. This is very important, and this is what I specifically put for the Valentine's Day. हमारे आज के Valentine's Day में हर लड़के को ये चीज करना है कि tobacco users के साथ नहीं देना है. Refuse to employ a tobacco user. Refuse to work with a tobacco user. अगर कोई आपका boss है, अगर आपका कोई senior है, आपका कोई colleague है, if he is taking tobacco, then we have to help them, or we have to make them get rid of this tobacco. So be careful and fearful, and that is why I've said second hand and third hand effects of tobacco are there, and each one can be affected. So this is very important. So at ICanCaRe, what we have developed, and this is in a nutshell, we have developed the app. We have developed a digitalized protocol-based treatment. This is the first time such a thing has happened in India. So it was never there earlier, and it is a change that is taking place. And we have equipped tobacco wellness centers. We have one at Max, and we are having multiple centers, one at Muradabad, and we look forward to have more centers at Ghaziabad, at other places. Then training a certified tobacco cessation specialist. We have got trained tobacco cessation specialist. Harshita is a CTCS, which is we are doing from Gujarat University. The self-help materials are there, e-pharmacy is there. The quit coach, which is again a person who wants to quit tobacco, उनको हम लोग hand hold करते हैं so that we can help them to quit completely. Central quit line number is there, which is there. This number is there as a quit line number, and the community network model is there where we can work at this. So a tobacco wellness program is a well-balanced program. It is a digitalized program, and it is individualized for the person, and it individualizes depending upon the requirement of the person, whether the pharmacotherapy is required, behavioral intervention is required, how to manage the withdrawal symptoms. The associated illness management has to be there, and the immunity, because these patients are low in immunity, we need to take care of. So अभी मैं एक ही चीज कहूंगा, कोई बहाना नहीं चलेगा, तंबाकू को इर्द गिर्द भी नहीं होना चाहिए, and this is what we have to say. And we will be learning more on this Valentine's Day special. We will be learning more from the learned speakers who will be talking about it. Those who still use tobacco, ICanCaRe is there to help you. Please understand, अगर आपके आसपास में भी कोई भी तंबाकू यूज करना है, just bring them in, and we will be there to help. Every one of you rise and take. Everyone has to rise and be empowered to save the youth. So this is where the need of the hour abhi is the manpower. You know, a lot of people, we just talk about tobacco. हम लोग बोलते हैं कि तंबाकू खराब है, तंबाकू नहीं लेना, but हमें skilled manpower की जरूरत है. We need to have more tobacco marshals. We need to have tobacco ambassadors and tobacco specialists. And this is what I say, network at all the levels of the society. From the जो जैसा बताया कि to go to the periphery, to go to the villages, we need to have a lot of volunteers. We need to have tobacco marshals at each and every unit, every society, every RWA. We need to have tobacco marshals, tobacco ambassadors who are again the motivators for the people to quit tobacco, and of course tobacco cessation specialists. They have to be trained. तभी सबसे बड़ी बात है कि lot of doctors are there who say that tobacco is bad, but they are not trained how to help people quit tobacco. So we at ICanCaRe are here to train, and this is what we are looking for. We have trained a lot of people. We are having marshals, we are having ambassadors, and we are planning to train as many specialists to make a number of them. So we have created the resources as well. The books are there. The Be Smart, Do Not Start book is there for the sensitization, and it is available in Hindi, English, Odia, Gujarati, Marathi, and it is a comic sort of a page book which can be given to all the schools and every place. And then we have got this assistance for the winovertobacco made easy. For the training, for the doctors, you know, tobacco cessation, and a comprehensive guide is there. And for the people who want to help the institution to be tobacco free, we have got the making an institution tobacco free basic manual. So these are the ladders, these are the steps, and we are lucky that we have this ICanCaRe Academy has been accredited by the Gujarat University, and we have got the training program at ICanCaRe to empower each and everyone in the society, and to have a put a full network in the society to take care of this tobacco, which is the biggest menace in the present era. So you have to take the lead on this Valentine's Day. I request everyone here to take the lead. Just call 4011-430-77695. Everyone can note down this number. We have the community page also. Please join us and take the lead to make our society tobacco free.